Hi, my name's Doctor Marcus Spry. I run a dental practice in Maidstone in the United Kingdom, and here are my tips for flossing your teeth correctly.
So, how to floss your teeth properly. Now, remember that what we're trying to achieve is the cleaning of the point where the teeth touch together. Okay, that's the whole point of flossing, because everywhere else pretty much you can achieve with your toothbrush. Okay, so I've taken myself, in this case I've used a dental tape. I like it because it's got more area to remove the plaque, which is the point of this, and I've got about 1.5 feet of the material. So I've stabilised it by winding it around my finger, which I can then slide into my mouth and then come down to the first gap there, can you see that? And then gradually just flip it in, okay? And then I've got two choices then. I can either pull outwards, or what I can do is, having got it into the gap, I can let go of the other end and allow that to draw through. And that's quite effective because this tail will clean the gap. Also remember that when you work it through, you need to work it underneath the gum as best you can. And there's two areas of that. One is on the back tooth and then on the front tooth. Okay, so working down into that as best as possible, because remember that the plaque forms right down into that point there where the gum meets the tooth. Okay, but it's not a bad idea to then rattle that through, and that will clean the gap. The other way is that we can use floss which is stretched across these arms of this C shape here, okay, and that will come in there. I hope you can see that. Okay, and we can just work that through. Okay, don't worry too much about the twang. Okay, the twang through there. It's okay. It's all right for it to do that. You obviously don't want to hurt yourself, so by sawing it slightly there, you'll get it to just gently go through without bumping too much into the gum underneath. Okay, if I move my hand like that, you can see it just popping through there. But then we would want to come underneath there and underneath there. And with this, of course, we've got no choice but to come back out again, sawing like that. And what you can do as well is, having positioned that into your mouth like that and got to there, you can actually close your jaws together, and that will and continue to move it backwards and forwards, and that will help it to pass through. Now if you get a gap that you just cannot floss, okay, stop and go and see your dentist or your hygienist and let them try and see whether they can floss, because if they can't floss it, you can't floss it either, and they will be able to adjust it so that you can floss it. For instance, you might have a bridge or some other dental filling or a restoration which is stopping you do that. So if you just can't do it, go and get some help. Otherwise, enjoy flossing.
Please like, share and subscribe, and click on one of these boxes for more tips on how to keep your smile for life.